Preventing heart disease, strokes, kidney disease and diabetes are priorities for the government to help improve the healthy life expectancy of communities. Local authorities will now have to work closely with clinical commissioning groups to offer everyone eligible an NHS health check assessment every 5 years and ensure checks are followed up.
Health checks are a very important programme. They're important because they're tackling cardiovascular disease, and cardiovascular disease is the biggest cause of morbidity in Merseyside and in Sefton, and one of the biggest causes of premature death as well. It's an ambitious programme. In Sefton there would be about 81,000 people who will be eligible to have a health check every 5 years, and if you translate that to across Cheshire and Merseyside, we're talking about 700,000 patients who will be eligible through this programme. So it's a very big programme.
I think everyone recognises that the one thing that's been really lacking in the management of these chronic diseases is the early identification, a systematic early identification process. And we believe that that's the missing link, that's the bit that has to be done really well. And our clinical colleagues agree with us on that.
The data that's collected during health checks is essential for predicting future health needs and also developing services. But there are some challenges around this.
Access to data may be a little bit of a challenge going forward. Previously, because public health was part of the NHS, it was fairly easy to share data because we were one organisation. And when public health transfers into the local authority, we will then have to have new data sharing agreements with primary care. So we'll have to share data in a different way, but that will be done through data sharing agreements. And we've already been doing some groundwork with primary care around sharing data and having a shared information portal. So some of that groundwork has already been done.
From a GP perspective, Dr. Craig Gillespie understands the need for accurate data collection.
Health checks should give a wealth of information to both CCGs and the Health and Wellbeing Board, and that they should be able to use that information by primary care having identified patients with immediate health needs such as diabetes, hypertension. That should help the Health and Wellbeing Board and CCGs understand what immediate health requirements the local population have. But not only that, and perhaps more importantly, by identifying these risk factors for future cardiovascular disease such as obesity, the risk factors being obesity, hypertension, high lipid levels, then by identifying them at an early stage, then using modelling tools, we should be able to predict future health needs for the local population and therefore be more intelligent about service provision for the future.
As NHS health checks moves into local authorities, how can existing relationships help the transition?
Public health have had a fairly long history of collaboration and close working with local clinicians and with more recently with CCGs, and with public health going to the local authority, then I would hope that that relationship that we have with public health already can strengthen the relationship with the local authority.
Not everyone likes going to the doctor. In Sefton they've found some clever ways of reaching the reluctant.
One of the other things that we've really worked hard at in Sefton is around a targeted programme. Because while we have our main programme, which is in primary care, where everybody gets the offer of a health check, we've also recognised that some patients won't go to their GP. And often they're the patients that we want to see the most. And so what we've done is we've built our other programme in pharmacies, where we've given them extra equipment so they can do near-point testing, which means they can do a blood test straight away with the patient. And we've used that group to actually target some of our groups in Sefton. So we've targeted areas of deprivation. We've done some work with women that we know sometimes don't realise that they're at risk of heart disease. They think it's a man disease. And so we've done work with local women to educate them and to have them have a health check. We've gone into public houses in Sefton to pick up some of our problem drinkers and offer them a health check as well. And we've had a really good impact and some very good outcomes when we've done targeted work like that.
Obviously, Public Health has been very, very good at working with a whole range of partners. But having seen what it's like to actually be in the local authority for this transition year, you do realise that all the connections you could have used haven't been used to the full extent. So I think that's the really promising and exciting thing about a programme like this, which is based in the community and reaches so many people in the community, the advantages of it being based in the local authority.
The Health Checks programme is a vital part of keeping the nation healthy, and local authorities will need to work closely with CCGs in the future to make sure people at risk are tested and treated.